My name is Gisela Ramos. The impact of chemotherapy on the neuromuscular components of gait. Definition: chemotherapy is treatment with drugs to stop cancer cells from growing, either by killing them or by preventing them from multiplying. Chemotherapy is given by mouth, by injection, by infusion, or on the skin, depending on the type of cancer and its stage. It is given along or with other treatments such as surgery, radiation therapy, or biological therapy.
So how does that feel?
All right at the moment,
No
yeah.
pain?
No, not at the moment, no. It's more about the side effects like last time. I mean, it was everything, wasn't it? It was the mouth, the stomach, just everything. When you're feeling yuck in yourself, obviously it has an impact on your mental state, doesn't it? You can feel people looking at you. You know you've lost your hair, but you still, when people are looking at you, you still like looking. I was looking over my shoulder to see who they were looking at. I thought, oh Christ, it's me. And some people will look you directly in the eye and smile. Some people just stare at you. Some people, smile. You get some
though, a
sort
lot
of
of
reaction.
people
People don't know what to say.
They don't know what to say.
Yes.
Oncological physiotherapy. It is a resource available to the patient to improve or restore their quality of life through their own treatments, the physiotherapy. Pros and cons. Pro, hair really strengths and pain the cancer patients as well as exercise regularly. Disadvantage of not applying physiotherapy, for example, anxiety, depression, sleep disturbance. En applying in Ecuador, cerca core of Quito and hospitales en Espejo, they are responsible for the rehabilitation of the cancer patient to recover to the maximum the innate ability or function that have been lost due to injury, trauma, tumor, or surgical process trauma. Training in resumption of physical activity in patients who finish their treatment, chemotherapy, and or therapy. It helps in the recovery of functionality in the immediate post-operative period.
My name is Abby Smith, and I'm an exercise physiologist at Viper Wellness Center. I'm also a certified cancer exercise trainer, and what I'm going to talk to you today about is exercise throughout the cancer process, whether it's when you first started treatment or it's complete. Exercise has been shown to help improve quality of life, aerobic fitness, muscular strength and endurance, fatigue rating, anxiety ratings, all sorts of things throughout the cancer process, so it's really good to incorporate throughout your treatment. We also offer water aerobics classes and restorative yoga classes for patients of the Cancer Center. They just need to get a little card so we can mark their attendance. And now we're going to show you a few exercises you can do at home using just basic equipment if you don't feel comfortable exercising in a gym. These are very simple, easy exercises that you can do on your own. So the first one is a leg exercise. We're going to do just a simple bench squat. So all you do is stand up and sit down. You want to make sure you have your hands out or on your hips so you're not pushing off of those knees. Good. Wonderful. The next one we're going to do.
Conclusion: the main objective of ecological physiotherapy is to preserve and maintain the motor functionality of patients affected by the intervention of cancer treatment.
Di was really struggling with her arm post her surgery. She was in a lot of pain, and I said, "Oh, we can sort that out." One of the big things when you've had a cancer diagnosis is any pain that anyone gets, people immediately assume that it's the cancer come back. So one of the great things about my job is being able to look at a pain and say, actually, no, that's part of the radiotherapy, part of the chemotherapy, part of treatment. Years ago, people didn't survive cancer, so people didn't see the side effects. People are living beyond cancer, but they're not living well. We know that physical activity is crucially important, particularly in cancer, for survival rates. You need to be kind to yourself and you need to love that body again to be able to move forward.
My personal aim is to do a mud run. Never done one before, but that's what I'm working towards. But that was down to Claire saying, hey, come on, get back out there, you can do it.
Thank you.